leave anything out that is relevant to your to why we're here today, but I think that probably covers it. So my first question is just what brought you to adolescent medicine?
Yeah, so my whole life, I've always loved people. I love science. And so it was like, do I want to go and work at a bench with like animals and cells, or do I want to work with people? And I love people and each person and every story that they have to bring and the opportunity to help somebody lead a better life, prevent unplanned pregnancy, prevent diseases, prevent heart disease, liver disease, smoking, all kinds of stuff like that. And then as I was going through medical school, I was like, oh, OB-GYN. But I didn't really like the surgery, and I didn't like the 24/7 on call to go catch a baby. And I found adolescent medicine where I could do outpatient gynecology without doing the surgery, without delivering the babies. And also, I love pediatrics. You can come to adolescent medicine from pediatrics or internal medicine. And I like the prevention aspect of it, that we're talking to a young person when they're starting their habits, and that you can have sex, but you don't have to get pregnant, and you can have sex, but you don't have to get disease. And so if we can give everybody comprehensive sexuality education, all their options, we can give people free access to effective birth control, which thanks to the Affordable Care Act, if you have health insurance, any FDA approved birth control should be available with no copay, no deductible. But we're working on the sex ed part of it, and we're working on the universal part of it as well. So that's why I chose adolescent medicine, which we call sex, drugs, rock and roll, a little acne, and some sports medicine.
I love that so much. That's so much fun. So kind of zeroing in then on the birth control aspect of it, what are some unique issues then that you've seen in your practice for teens when it comes to accessing birth control and using it?
So accessing, it's about confidentiality, and the American Academy of Pediatrics, the American College of Obstetrics and Gynecology all stand behind confidential access to reproductive health care. And the way I explain it to parents is during our visit as adolescent medicine, and I train all the pediatricians to do the same, you kick the parent out of the room and they're like, what? And I like, just checking in, make sure everything's all good. Because sometimes your kid doesn't feel comfortable talking to you. And they've shown in the research that if you don't give kids access to confidential birth control, they're not going to not have sex. They're going to continue to have sex, but they just won't have birth control. So if you want to prevent unplanned pregnancies and you want to prevent sexually transmitted infections, then we as a public health measure, we as a society need to give access to teenagers to confidential reproductive health care. And unfortunately, just like reproductive rights is about to go, it's a state by state situation. So California, anyone of any age has the right to the diagnosis, treatment, and prevention of pregnancy. Any age. Other states, it's 16 and above. Other states, you have to notify the parent or you have to get the parent's consent. And people are like, oh, it's notification. It's no big deal. If the teenager thinks that you're going to tell, then they're not going to access care and they're still going to have sex. If you remember back to your horny teenage years, things happen. So we much rather that our youth be protected against pregnancy and sexually transmitted infections, specifically HIV. As well, right?
Absolutely. Yeah, that makes so much sense. And I also, just from my experience helping young people access abortion, the difference between, like you said, between notification and consent from a parent can be very small, because once a parent knows, they can prevent access to care. So it is, the notification is a much bigger deal than I think sometimes people realize. So my next question is, are there any birth control myths that you want to bust for us today?
Absolutely. I love social media for the opportunity to do what I call Pandia PSAs, public service announcements. So Pandia PSA number 1 for today: does birth control make you gain weight? I want all of you to yell, no, it doesn't. And that's based on research. So research has shown if you put 100 women on the birth control pill, which is equivalent to the patch in the ring, and 100 women not on anything, and then you check on them after a period of time, a year or 10 years, The women on the pill, on average, lose a pound. Not a pound a week, not a pound every day, just a pound. The women over here are 1 pound more in weight than women over here on average. And the reason for that is over here, your hormones are like up and down, up and down, up and down. And so you're bloating up and down, up and down, up and down. And over here, the hormones are just stable. And then once every 3 weeks or however often you want to choose, the hormones drop. But there isn't this up and down kind of bloating thing. So it doesn't make you gain weight. However, we do want you to know that some of the progesterones, and there's 8 different progesterones you can choose from. There isn't 8 in one birth control pill, but there's 8 different ones. And if you're on one that's more androgenic, that's kind of male side effects is the way I think of it, it can give you the munchies. So it's all how you respond to the munchies. If you respond to munchies as I do with chips, desserts, deep fried things, hamburgers, pizza, you know, the stuff that isn't so healthy for you, then you may gain weight. But again, in group studies of 100 women over here, 100 women over there, in general, it does not cause you to gain weight. But if you notice on the pill you gain weight, then hell yeah, talk to your doctor, tell them this is giving me the munchies. I heard from Dr. Yen of Pandia Health and also of Stanford, if that makes them feel better, Stanford, invoke that, then that there are 7 other progesterones. Please give me a less androgenic progesterone. And if they're like, what? Then you're like, hit up Dr. Yen. She will teach you how to write birth control correctly. So at Pandia Health, I personally wrote 2,000 birth control prescriptions over 2 years. And then using my MIT, UCSF, Stanford brain, applied that to look at the side effects. And so I actually made a chart from least androgenic to most androgenic, least progestational to most progestational. And with that, we can manage and fine tune any side effects you have with your birth control. And we've taught all the doctors on Pandia Health's platform to do the same. So at Pandia Health, we provide, we think, the best care in the field for birth control because we're the only one that's headed by a doctor, an academic, somebody who has an MIT, UCSF, Stanford brain applied to this problem. Because as I like to say, I live, breathe, eat, and prescribe birth control. And I have 2 daughters, and I made this company for me, my daughters, and anyone with a uterus.
That I want to go, like, you make me want to go to a physician that has this chart because I feel like that is not the experience that I've had or the experience that I've heard from many people that I work with or am friends with. Like, this is not our birth control experience. So I feel like this conversation is about teens, but this is revolutionary across the board, which is very, very exciting. And I love that. So
let me hit a couple more side effects.
Oh, yes.
I totally forgot. I got all into that. Pandia Health PSA number 2. Does birth control make you infertile? And my joke is, yeah, well, you're using it. That's why you're using it, but that's a joke. The real question is, does birth control make you infertile after you stop it, right? And the answer is almost all of the methods are out of your body within 3 days, or at the maximum 7 days. 7 days, because that's the half-life of the drug. So if you're taking a drug every single day, then it's out of your body by day 7. And with the patch, it just lasts longer because it's on your body, and the ring, the same kind of thing. The IUD, the implant, the only one where that doesn't apply is the shot. That's Depo-Provera. And the reason why is you shoot it in and it's hanging around for 3 months. And so after 3 shots of it, I think on average, it can take 8 months to a year for it to wash out. So, but most of the people that are using it are young people. They could wait 8 months to a year before getting, pregnant. And on average, it takes 8 months to get pregnant. But you have to add another 8 months, to a year ahead of that if you're planning out your babies. But know that the reason why you get that withdrawal bleed is because the hormone has withdrawn from your body. And that's why you bleed on the pill, the patch, the ring. And then again, the IUD, I love to say that, if I had the hormonal IUD or the copper IUD and I was stuck on a desert island with the hottest man on earth and there was, no hope unless I had sex with him now and had a baby, I could reach up there, yank out the IUD, and then let the uterus grow its beautiful, rich lining. In 2 weeks, bam, we could have a beautiful baby. Well, pregnant. We get pregnant. 9 months later, we'd have a beautiful baby.
I love
That's
that.
the myth. And then was there a third myth? Oh, zits. So, Pandia PSA number 3, does the birth control pill patch ring make your acne worse? And again, the research has shown if you have 100 women on any birth control pill and then therefore extends the patch or ring, and 100 women not on it, and your acne is exacerbated by your hormones going up and down every single month, then everyone does better on the pill patch ring than the people who do not. However, as we talked about before, there's 8 different androgens, and if you notice you started this pill and it's giving you crazy zits, talk to your doctor, ask them for one of the other 7 types of androgens, or for any androgen in a birth control pill, there's 2 different levels. And so sometimes you can go to the lower level, but the lower level, there's caveats on that because you don't want too low of estrogen, because usually when they lower the androgen, they also lower the estrogen. And so if you're under the age of 30, so teenagers, you want to be on at least 30 micrograms of estrogen, because oftentimes a lot of people go to their doctor and like, I want the lowest amount of hormone possible. And I was like, if you're a teenager, young adult under the age of 30, you want at least 30 micrograms of estrogen to protect your bone density. And particularly for minorities who have lactose intolerance, Asian, Blacks, Latinos, where we don't get so much milk, you want 30 micrograms of estrogen until you're 30, because you're building up your bones. And if you only have 20 micrograms of estrogen, not good for you. And again, if your doctor has any questions, you can tell them Stanford Adolescent Medicine, Stanford Pediatric Gynecology, Stanford Pediatric Endocrinology all recommend at least 30 micrograms of estrogen to protect your bones. And if it were me, my daughter, my friend, my patient, same thing.
That's so fascinating. And I love all the different kind of takes beyond, like, you know, the benefits and the limitations for our bodies that are so unique to young people that we don't get to hear about so much. I mean, it's so much beyond access and beyond just preventing pregnancy. And that's why I'm super excited to have you here today. And you've been a supporter of Right by You since our inception. And I just wanted to ask what attracted you most to the work that we're doing specifically in Missouri.
I think it's, so important in Missouri and other conservative states where you don't have access most of the time to comprehensive sex ed. You don't have access to birth control, be it because of your state laws or whatever, is out there. And so it's important that people have all options counseling, not biased one way or the other, but you're pregnant. What do you want to do? Here are your options. You can continue your pregnancy, you can continue it and give it up for adoption, or you can terminate the pregnancy. But to have all those options presented in a fair, safe way. Again, a Pandia PSA, watch out for crisis pregnancy centers. So they don't label themselves crisis pregnancy centers, but they label themselves pregnancy centers. And sometimes the people in the white coat have no medical training. If they're asking you to run the pregnancy test yourself, they are not a medical institution. And unfortunately, we have that here. Even in the heart of Silicon Valley, they have crisis pregnancy centers, and there are some physicians associated with them. And I was like, did you know that this institution has no obligation to do things in the way we do it in medicine, which is informed consent based on evidence and science, and to give you all your options. And they'll tell people lies like, did you know if you have an abortion, you're going to become a crack addict? Or if you have an abortion, you're going to become sterile? Or all these things that are not true. Abortion in the first trimester is actually safer, unfortunately, because we have horrible maternal mortality in this country, safer than continuing your pregnancy to term. Not to say that we should terminate the pregnancy, just saying it is a very, very safe procedure if you need it. And so that's why we absolutely support Right by You, because you're providing comprehensive options for anyone who needs it, and you're doing it in a cool, modern way, the way people need it.
Thank you so much for that. And I also want to bolster what you said. I'm not sure what the crisis pregnancy centers look like there, but here they're also lying about birth control. And so that's definitely something that we want to stand against and be an alternative resource for folks, where we can actually hook people up to people like you and others in the community that are actually working to give real good information to folks about birth control and get them connected with that care. So yes, the crisis pregnancy centers are a real problem here. But kind of turning back to Pandia Health, can you tell us a little bit more about your organization, Pandia Health, why you started it, and how it helps teens get access to birth control.
Yeah, so I was giving a talk to a bunch of doctors because I teach doctors how to write birth control and how to prevent unplanned pregnancy, sexually transmitted infections. I teach the future doctors how to take care of teenagers properly. And I also teach current doctors as well. So I've given lots of talks. And we were like, why don't women take their birth control? And one of the top reasons was they didn't have it in their hand. And everything was just about coming to by mail, their Amazon, Etsy, eBay. And I was like, well, why doesn't birth control come by mail? And certainly there's always been mail order pharmacies, but they're focused on the 80-year-old with 5 drugs 3 times a day. And I was like, but this is a problem for anybody with a uterus from age 12 and a half until 50. That's like 30, 40 years that you could have this customer. But also I'm all about preventing unplanned pregnancy and making women's lives easier. And I actually coined the term, feel free to use it and attribute it to Dr. Yen, pill anxiety. So if you look at this pack of pills, there's 3 weeks. And then that last week, if you don't get to the pharmacy by the end of that week, you're freaking out. And we suffer from pill anxiety subliminally, just another stress in those of us with uteruses lives every single month for 30 years of our lives. And so the whole point of Pandia Health is set it and forget it. Let us worry so you don't have to. And we're starting with birth control. We're adding on acne. We're going to do menopause. And we want to be the site that you trust when you have any health question, because we're by a doctor, we're by women, for women. So that's the difference between a doctor CEO, and no offense to all the MBAs out there, and an MBA CEO. Because one, they don't know what they're doing. They don't know the principles of informed consent. They haven't taken a vow to do no harm. And I'm here to make money for my investors, but I don't have to do it not giving you the best possible care out there. Because I think by giving you information, giving you the best possible care, then you'll like us and you'll stay with us. And that, is kind of our competitive edge. So at Pandia Health, if you have a prescription, just tell us where it's at. We'll move it to our pharmacy. And then with every package, you get a free goodie. Right now, the default is high chew. So if you like candy and a little bit of high chew, but sometimes condoms, sometimes stickers, sometimes a discount off of a vibrator, some almond roca because I like chocolate when it gets cooler so it doesn't melt in the mail as it comes to you. And then also has a postcard usually in every single one, what we call the Pandia PSA, with a random fact about birth control. Did you know you could use it for acne? Did you know you could use it to make hashtag periods optional? Do you know about Plan B and its limitations by BMI? Stuff like that. And then we'll send 1, 3, 6 months or 12 months of birth control, depending on what your doctor wrote for and or what your insurance will cover. Or if you're a cash patient, it's $15 per pack of pill for most 95% of generic birth control pills, which is less than 50 cents a day. And then set it and forget it, and we send it to you. So one thing, if you are using your doctor, and we unfortunately can't write prescriptions in Missouri, but we can absolutely deliver to Missouri, ask them to write a year's supply. Because as a doctor, I would always write dispense 1, refill times 12. And I was like, what's the problem? I gave you a year's supply. I didn't realize the pharmacy can only give what the doctor said. So I said 1, refill times 12. I've chained this woman to the pharmacy, but I could give 13 packs. And then if the insurance or the pharmacy can't do 13, then they can just bring it down, and then they'll have remainder leftover stuff. So educate your doctor to write a year's supply or 13 packs or 17 packs if you're skipping to have a bleed, and that'll make it easier. If you need a prescription, we can write the birth control prescription in 14 states. I can't name all of them because there's so many now, but there's California, Florida, Texas, Nevada, Georgia, Illinois, Michigan. And so we encourage birth control tourism. If you're visiting somebody, you go for a nice drive into one of the 14 states. You can fill out the questionnaire, pay $20 once a year to use our expert doctor with unlimited follow-up questions on birth control, and then go back to your state. We can deliver to your state, but we need you to be physically in a state that we can prescribe. So if you're visiting any of the Disneylands, or you're going to Vegas or anything like that, or grandma's house or whatever, then you could fill out the questionnaire and pay the $20 while you're there. We can legally take care of you because you were in a state that our doctor could prescribe, and then we can ship it to any state that you want.
That's super exciting and not something I thought about. So is it the case then that the parental notification or consent requirement attaches to the state where they do that?
Yeah, so I advise you all to go to California. Or maybe Nevada too. I have to check that one.
Possibly Illinois. I'm not sure. I don't quote me, but that, I mean, Illinois is next door for a lot of folks in Missouri, and tends to be a little bit lighter on those requirements. So that might be an option that we'll have to look into to refer our folks.
Yeah, no, because I'm an adolescent medicine specialist, I've made sure that we know our laws, one, so we don't get sued, and two, so we can provide care to whoever needs it. So, and then another trick for adolescents access, I'm so sorry I didn't address this earlier, is the Title 10 family planning clinics. So those are like this federal safety enclave within your very conservative state. So if you can get into a Title 10 clinic, they can provide adolescent confidential reproductive health services regardless of what the state law is, because the federal trumps the state law, I think. So if you just Google Title 10 clinic, and then you put in your zip, they'll tell you the clinics that's close to you, and then just call and say, can an adolescent get confidential reproductive health care? Because I'm like 99.9% sure that you absolutely can at a Title 10 clinic. Unfortunately, we haven't gotten the Title 10 certification because it's complicated and we're this, you know, telemedicine company. So we just didn't go there or wanted to deal with it. But for anybody under the age of 18 who needs that, know that that is there.
Yes. And you're absolutely correct that young people can get it confidentially from their parents at Title 10 clinics. And if you're in Missouri, there are also clinics called the Right Time clinics. Those include Title 10 clinics, but there's an additional set of clinics that follows those same guidelines. So we use that as a referral for young people that need to get that confidential care. We use the Right Time, and then we also, they actually have a great searchable database online. If you go to I think it's the righttime.org. So that's been really useful for our folks, but also I think that there are many young people in Missouri who would find it very convenient and actually like benefit their access a lot to be getting it by mail. So I think that having both of those options available is critical, and knowing that they could possibly go to a neighboring state in order to make that a little bit easier. One question is about the packaging. So if a young person orders it, goes to Illinois to avoid the, involving their parents in it, what is the packaging like when it arrives?
The packaging is very discreet, and it usually says like True Pill, a PH company, PH being Pandia Health, or it might say Pandia Pharmacy or something like that. But it's just a white bubble mailer, and the outside just has your name, and we can mail to whatever address you want. So if you have a bestie or an auntie or whatever, or most kids are home before their parents, so they can intercept the mail before, and we actually send you a tracking so you can follow it and know exactly from the USPS. We are limited by the USPS, so sometimes the USPS is wrong or late or whatever, but in general, they've been pretty amazing. I mean, it's just amazing, our postal service. It's just unfortunate that the previous administration decided to put in a dude in charge of it who is totally anti-government. It's just always crazy to me when you have a party that's anti-government. Why do you let them run the government? Because it's not in their interest, but it's in our public interest to have good schools, good mail systems. So we need to fix that, but it's pretty good for now.
Yeah, I love that those delivery options are available, and that sounds like it could be a very useful way for young people to get that access, especially like I can think of rural young people who may not have the transportation to get to a clinic, that could be the best way for them to get access to that care.
Just jump in.
Yeah.
One way to get birth control, not for birth control. So know that if you have horrible acne that happens, like I used to always get one giant zit, I called it the North Star, and it would happen here, here, or here with my period. And with going on the birth control pill, went away completely. The other thing is, as a tiger mom from Silicon Valley, is your daughter going to do better on her SAT or finals bleeding or not bleeding? Because my daughter is going to at least move her period away, or at least have the option to make #periods optional. So go to pandiahealth.com/periods optional. At the bottom is my TEDx talk on the signs and safety of not bleeding every single month, watch this video, share it with your parent, and be like, I'm going to be more productive. I'm going to have a decreased risk of ovarian, endometrial, colorectal cancer. I'm going to contribute less to landfill if I have lighter, fewer periods. And so you can get birth control, not for birth control, but for hormonal treatment. And that's how you get parental consent, is that you want to crush it on the SAT. You want to crush it on your finals. You want to crush it on your sport. Because I saw the women's soccer team and like, we have this app and we like synced it and made sure we got enough sleep and nutrition. And I was like, who's your doctor? Because if I were your doctor, there's no way you would be bleeding anywhere near the Olympics. You would just be crushing it, keeping the blood in your body so you have more oxygen to run around, but also not risking having a cramp or a tampon or a maxi pad falling out or discomforting you during your sport. Certainly, I'm a feminist and I love the shirt that says, I can do anything you do, bleeding. But my caveat to that is why? Why bleed if you don't need to bleed? So this is one way to convince your parents. Show them my TEDx talk, Dr. Yen from Stanford, giving a talk on you don't have to bleed and that this is a life hack. The number one cause of missed school and work for somebody under the age of 25 is horrible, painful periods. So if you are missing school or work because of horrible, painful periods, or it's affecting your performance, please see a doctor and get birth control, not for birth control, but for hormonal treatment. And this is a way to get people access if your parents will let you access it for birth control. Hopefully they'll let you access it so you can go to school, you can decrease your risk of cancer.
Absolutely. And I will be heading off to watch that TEDx talk later today. That's assured. And also, I mean, this is speaking so much to me because when I was in high school a while ago now, it was such this way. I mean, friends were missing school. I was missing school. And so like that's very real, like needing it for pregnancy prevention, but also needing it in order to actively participate on an equal basis with everyone else. I mean, that's very, very real for young people. And I'm so glad that you made that point. So with that, where can teens in Missouri or from anywhere they're watching follow Pandia Health, find out more, or order birth control? I mean, we've talked about it a little, but I'd love for you to say it again.
Yes. So please, please, please check out pandiahealth.com. The way you can remember Pandia, pan is every, dia is day. So we want to take care of you every day, set it and forget it. Let us worry so you don't have to. Pandia is also the Greek goddess of healing, light, full moon. So just Pandia Health on every social media platform. Please follow us. Please like us. Please share us. We're on Facebook. We're on Instagram. We're on TikTok. We're on YouTube. We have some YouTube videos with 300,000 plus views because here's Dr. Yen's tips. First time on birth control. Don't take it first thing in the morning on an empty stomach. Take it, with food at night before you go to bed and other tips like that. We also have a huge blog, a few huge frequently asked questions, lots of juicy, useful, evidence-based, science-backed, reviewed by a physician information on our website. So pandiahealth.com.
Awesome. And is that where folks should go if they want to take the first steps toward ordering birth control?
Yes, thank you for clarifying. If you want to get your birth control delivered, go to pandiahealth.com and just hit that sign up button. If you want to get a doctor's consult, if you're in one of the 14 states or visiting one of the 14 states where we can prescribe, hit that sign up button, say, I need a doctor's consult, fill out 20 questions. We will need a government ID. But if you don't, we can also take like a school ID, just a photo ID with your name on it would be ideal. We need a selfie. If you're going to pay with insurance, the front and back of your insurance card. If not, then a credit card. And then we also need a blood pressure from the past 365 days. And so my fun tip on that is most fire people are also EMTs. So you can just call them up and say, hey, can you check my blood pressure for a doctor? And they're like, sure. And then just go there, sit calmly for 5 minutes because some of the fire people are pretty hot. So you want to sit calmly for 5 minutes, then check your blood pressure and have that number because we're going to need that number in order to safely prescribe you medication.
Awesome. Thank you so much for that. And that's the end of my questions. I don't know if you got to share everything that you were wanting to share today. I feel like we got a ton of great information, so I'm not complaining.
Thank you so much for doing this and sharing this with all of your followers. And I hope that, this will be helpful for anybody who had any questions. And anytime you have guys questions, please hit us up on Facebook, Insta, whatever, YouTube. We will try to get to them. And if we don't, generally we do. So, but if we don't, just keep pinging us. And yeah, spread the word about the only women founded and women led, and more importantly, the only doctor led birth control delivery. Put your money where your values are, and tell people about us.
Thank you so much, Dr. Yen.
Thank you. This was such fun. Let's do it again.
I would love to. I'm sold already.
Well, have a great weekend.
You too. Bye.
Bye.